What advice would I give to a new public health graduate? Hi, everyone. My name is Omari Richins, founder and CEO of the Public Health Millennial and host of Public Health Careers. So, this question was asked to me very recently by a student, and I think is a question that a lot of people are having on their mind, especially considering what the public health landscape has been looking like this year in 2025. And I think the first thing that I would say, like, if you don't have an opportunity right now, understand that there are opportunities out there and you have a skill set that is valuable not only in traditional public health realms, but can be taken and transferred into so many different spaces. That being said, to be honest, it is going to be hard. There have been many reductions in the health workforce, and a lot of those people are looking for jobs and they are more experienced and they're more technically skilled in a lot of ways. So they're more likely to get the jobs that are out there. But that's not to say that organizations and places are not hiring public health professionals. They absolutely are. Every day on LinkedIn, I see people getting hired. So know that there are jobs and there are people hiring. What you might have to do right now is just be more proactive than you thought you would have had to been, because it's so important, because everyone right now is looking for jobs. Everyone is looking for an opportunity, a way in. And in that way, you really have to ensure that you are taking the steps to position yourself to land those interviews, to get the job. So beyond like getting your resume, tailoring your cover letter, what are tangible things that you can do? You can start reaching out and having conversations with people that and organizations that are of interest to you, and just learn more about the work, learn more about opportunities. Ask everyone that you speak to, is there someone that I should be connected to? And really build on that experiences and build on that network and share that you are open to opportunities. And even when you're applying to jobs on LinkedIn, I think it's really important right now that you are taking time to reach out to the hiring managers and finding time on your calendar to sit down with them and ask them more about the role and learn more about what they're looking for. And then kind of ask yourself, from this information that I'm getting from them, how can I position myself, my skills, my experiences, my understanding of that sector and that field, and my willingness to grow and put in that work, and showing this to them in through your resume, your interview. How am I best able to do that? And really trying to understand what the roles are and how you can speak to your experiences in a new way. And I think the skill sets, the public health skill sets, some of them, the foundational ones around policy analysis and health promotion and epidemiology and data analysis and leadership and project management, as well as systems thinking, are useful. Like when the pandemic started, we saw people getting hired at a higher rate at Disney cruise ships. And this is the case now. Like public health jobs or public health skill sets are needed so many places outside of public health. So with that, I say also take time for yourself. Understand that the first job that you might be getting an offer for is a job that you might have to take just to live. And while you get that job, you are continuing to build connections, continuing to apply to roles that are more fitting for you, and ensuring that you're continuing to develop the skills and the experiences that you're able to speak to through your resume, your LinkedIn, online, and even start talking about public health topics and asking questions around public health topics on LinkedIn. That way, you are more known in the field, and companies are more and more sometimes relying on their workers to be the catalyst for sharing information about the work that they're doing, and not just working underneath the organization, but having the each personal brand be an asset to the company. So just think about that when you're on LinkedIn and commenting on LinkedIn and liking posts, because it's such a useful platform in so many ways. So getting back to more tactical things that y'all can do, because I still see jobs and like I work in my 9 to 5 in health philanthropy, and that is a space where they're still hiring people and there's still a lot of opportunities. And I think the field of health philanthropy is ripe for people with a public health skill set to come in and do this work. And if I had to give you seven like fields that you can think of when you're looking for jobs currently. Of course, you can continue to look at traditional roles. There are still roles out there. There are still people that are hiring. Just a lot of different restructuring, and we don't know what the future holds in a lot of ways. But outside of that, you can think of health technology. You can look into health philanthropy, pharmaceutical and biotechnology, health insurance and managed care organizations. Think about corporate wellness and employee health. Think about venture capital and health investments, or even public health consulting and entrepreneurship. There are ways that you can continue to develop yourself while you're looking for a job. And I think it's really important that you have your long-term goal in mind, because this situation right now is very similar to what a lot of people have experienced, broadly speaking, when the financial crisis was happening in 2008, 2009. It's very similar, but it's now more acute to the health field, the public health field, when we have government really restructuring how they're going to be doing this work, and a lot of unclarity or no clarity in what is happening. But, or and I should say, there are still opportunities out there. It might look different from what you thought it was going to be when you started your program and you're graduating now, but you really have to be able to get creative and mold yourself and your skill sets into the new public health field that is emerging. And regardless of like what jobs you're thinking about, just realize that the issues and the inequities that are happening in communities continue to happen, and there will continue to be space for work that improves that. And that's why public health and the public health lens and the skill sets that you have are just so valuable. They're invaluable in so many ways. So while it might feel tough right now, remember that this is one moment in your entire journey. And I know I say this from a place of privilege where I still have my job. I didn't come into the workforce in such a volatile time, but I'm saying this to you as there's no other way than to stay positive and to stay proactive to get to where you have to get to. Lean on your friends, lean on your community, lean on things that are not just public health, because you are more than a job, you are more than public health. While jobs are important because they put food on our table, they help us feel safe and secure, and it's important. We know how important it is in public health. But just know that there are going to be opportunities, and really just putting your best foot forward and continuing to take those steps, and having friends and accountability bodies and people that you can vent to is so important while you are working to find the roles and the jobs and the opportunities out there. So that is my word to you all today. You know, it's tough right now, but getting through this tough part is going to be the story that you're able to tell to the next generation. And the advice and the insights that you gain from this time are going to help you be an even better professional and an even more impactful public health worker. So I appreciate you all. I hope you all are doing things to take care of yourselves, family, friends, things outside of work to rejuvenate, restore, heal, do all the things. Here for you all. Tap in with me. Appreciate you all. See you all next week. Sorry for the late episode. Take care, everyone.